I'm Dr. Aditi Malhotra Yadav, and I'm going to be practicing at the Skillman, New Jersey location, which is located in Montgomery Township.
Tell us a little bit about your professional experience.
I was born and raised in New York, and I actually graduated from the Physician Scientist program at Rensselaer Polytechnic Institute, followed by Albany Medical College. I graduated with an MD with a distinction in research, and it was after that that I then completed my residency training. Upon request, I also served as chief resident for the internal medicine program at Stony Brook University Hospital. After becoming a board certified internist, I joined CVR, where I completed my vascular fellowship in venous and lymphatic medicine, and here we are.
Why did you choose vein care as your specialty?
So I chose vascular medicine as my specialty because I wanted to fully dedicate myself towards serving and helping those who suffer from venous and lymphatic diseases. They can be extremely debilitating diseases that significantly impact a patient's quality of life, and I wanted to be a part of making sure that these patients are taken care of in the most appropriate way.
Why did you choose to practice at CVR specifically?
I chose CVR because I knew that as part of the CVR family, I'd genuinely be able to comprehensively care for my patients and clinic staff to the absolute best of my abilities.
What is your philosophy of patient care?
My philosophy of patient care focuses on teaming up with my patient in order to provide the best possible care for that person's vascular health in a very complete, comprehensive, and thorough manner.
What unique skills do you possess?
Throughout my training and medical career as well, I have focused not only on the importance of learning, but also the importance of teaching. So I have had the honor and privilege of holding multiple teaching, leadership, and mentorship positions throughout my life, including being chief resident of my internal medicine residency program. And each of these experiences has given me a significant and unique ability to not only take a comprehensive journey with the person that I'm taking it with, but also to be able to break it down and take it step by step with that other person.
How do you see your role in helping your patients?
My role is to dedicate myself fully to teaching and teaming up with my patient in order to provide the best possible care for that person's vascular health in a complete and thorough manner.
What would you like your patients to know about you?
I love taking a unique journey with each of my patients in order to care for their vascular health in the most comprehensive and thoughtful manner.
What would you like your referring physicians to know about you?
Given my internal medicine background, I treat patients in a holistic manner, and when caring for their venous and lymphatic health in the most thorough way, I always take into account how it fits into the body as a whole. I just feel extremely, extremely privileged to be able to care for my patients, and I feel extremely privileged to those who send me their patients because I want to make sure I take care of them in the best of my abilities.